Our stories are brilliant. We are resilient. Our stories are brilliant. We are resilient.
Hi, everybody. Welcome back to Resilient. Today, I'm going to dive into a really deeply personal and challenging topic for me, as well as a lot of other people with chronic disease, chronic pain, and how to manage it. If you're listening right now, you likely know firsthand how disruptive chronic pain can be in your life. If it's your chronic pain or a loved one, it can really impact everything from your sleep and your mood to your ability to work and your ability to enjoy things. But today we're going to talk about how there's hope and there's effective ways to manage pain and reclaim your well-being. And of course, not everything works for everyone, but I'm just going to offer a few today. According to the American Chronic Pain Association, 1 in 5 adults in the United States experiences chronic pain. Isn't that staggering? That's a crazy statistic, but it highlights just how widespread chronic pain is. And of course, chronic pain isn't just physical, right? It has emotional and psychological dimensions as well. I mean, I can tell you, and I'm sure I'm not the only one, that when I'm having a flare and I'm in a bunch of pain, it makes me depressed and it makes me, it's easy to fall into that hole of thinking that nothing's going to get better. It's such a complex thing, really. There's factors like past experiences and I don't know, again, about you, but my stress level contributes to my pain levels. And then even your thoughts about pain can contribute. So today, one of the things I wanted to talk about was some strategies and some insights from resources that I've looked at recently. One of them is The Pain Relief Secret, which is a book by Dr. Stephen Standiford. And I also looked up some information that was provided by the U.S. Pain Foundation. If you want to check that out, that's uspainfoundation.org. And again, the book I looked at is The Pain Relief Secret. I mean, there's not just one secret, but Dr. Standiford's book really talks about the connection between the mind and body as far as managing pain. He talks about the effectiveness of techniques like mindfulness meditation, and he also talks about cognitive behavioral therapy, which is CBT. That's something that I'm very familiar with. I've used both of those things in my own life and in my own therapies, millions of therapies. In these approaches, Dr. Standiford wants us to reframe our relationship with pain and kind of shift from a place of resistance and fear to one of acceptance and management. That's a hard one for me. I mean, that's part of the grief part, because accepting it means that it's never going to go away. And I don't love that, but it definitely helps to know that for me anyway, it's not a constant pain. Mine is with flares. So I don't know how it works for other people, but the cognitive behavioral therapy and the mindfulness are both things that have helped me. So I encourage you to look those up and check out the book if that's interesting to you. So the U.S. Pain Foundation also emphasizes the importance of physical activity as part of your therapies. It might seem counterintuitive, right? When you're in pain, you don't want to do anything. But gentle exercise can actually improve circulation, they say, and reduce stiffness and boost your mood. I know all those things, and it does help when I remember to do it. It's about finding activities that you enjoy and that are appropriate for your individual limitations. So even if I walk down the block, if I can walk that day or gently stretching makes a difference for me. And that's what the Pain Foundation says. That's at uspainfoundation.org. They have a whole lot of other resources you can check out there. And when I can't walk, because of my disease, I like to just sit outside. Having fresh air in my face makes such a huge difference. I often forget that, and I'm lucky to have people in my life that remind me. My husband reminds me of that a lot. Just go outside. or when I feel like my pain makes me separate from my family. That's a hard one for me, but being present can help. I can remember sitting on my back porch while my kids were playing and they were jumping on their trampoline, even though I couldn't play with them and I really wanted to. Just being with them felt so good. As an aside, I also think that family members of those of us who have chronic illnesses learn a lot of empathy. I wish that my family didn't have to, but there you are. And I do think that they're pretty empathetic. Another thing the Pain Foundation talks about is sleep. Sleep is such a crucial factor. Getting enough quality sleep is essential for the body's natural healing processes and overall well-being. I mean, we all know that. Prioritizing good sleep is so hard. There's so many fun things to do. And good sleep hygiene really does improve your pain levels. It's very hard. we do that a little bit. I'm working on sleep hygiene has been something that I've been trying to work on all of 2025. That's sort of I don't do New Year's resolutions. I do kind of goals for myself. And my goal is better sleep hygiene. And I guess by that, I mean just more sleep. One of the things we do in our house is we turn off devices like a half hour before bed. And we've never had phones in our bedrooms. That does help us. It's a small thing. I also don't have a TV in my bedroom. No judgment to people who do either of those things. It's fine, whatever works for you. But we read some research about needing 30 to 45 minutes to kind of switch off your brain. And that seems to work a little bit. I mean, honestly, I've been a poor sleeper my entire life. Even as a little kid, my mom tells me, I never used to be a sleeper, which was probably not my parents' favorite thing about me. I had a brief period when I was post-brain injury, where for a few years I could fall asleep anywhere. It was the best. Honestly, at the drop of a hat, I'd fall asleep on the way to the hospital in the morning. And I'd fall asleep in the car going home every day. In fact, I fell asleep pretty much every time I got in the car. I even had a nap built into my school schedule when I was going back to school. But by the time I was mostly recovered, that little magic trick kind of went away, and now I'm just back to being Jenny no sleep. I'm working on it. Like I said, I'm working on it. That sounds so old person of me, like working on sleep hygiene, but that's what I'm doing. Another option for pain relief can be marijuana or cannabis. When my pain was really, really bad, they gave me all kinds of narcotic pain medications. The autoimmune disease that I have makes my muscles and my joints swell up. It's all different kinds of weird places, like my calves and my forearms and my face. I always say that it's like I get face filler with all of the pain and none of the benefits. My mouth gets huge, my face swells up, among other stuff. Also, my trunk muscles get so painful that it's just excruciating to lift myself up from horizontal. I can't. My joints are so painful, I can't walk. So anyway, they gave me all these heavy-duty drugs when I would go to the doctor, and God, I hated the drugs. I hated them so much. They made me woozy. My head was spinning. They made me nauseous. I was pretty much out of it all the time. Plus, everything still hurt. So I just stopped taking them. I was lucky to live in a state where you could get a medical marijuana card at the time. It was a whole long thing. You had to get a doctor's note saying you needed it. You had to go through all these classes. You had to pay like $200, I think, at the time. And I was super conflicted. The attitude about cannabis has changed so much nowadays, and I'm glad. But at the time, I didn't want to because of the stigma, and I had little kids at the time. It sounds so dumb to say it. Just to be clear, it's not like I'd never done it in college, but I wasn't sure if it would work for my pain, and I didn't do it anymore. But it really did. I didn't have to be like high or anything. I could just be not in pain when I needed it. I didn't have to be that way all the time. I also took classes where I learned how to make topical recipes that are really, really helpful on the joint pain. I make a salve that is just so useful because it works from the outside in. It just kind of penetrates to the deep pain that I have. Now, I live in a state where it's legal anyway. But I share that to say that thinking outside the box was so useful in my case. And I want to encourage you to do the things that might work for you. even if they're different than you're used to. I mean, thankfully, all the attitude about all that stuff has changed so much. And part of what's great is that learning about how that worked for me, it helped me say yes when my doctors at the NIH suggested using a drug on me that I'd never heard of. I use something called Kineret. It's used for other things, but it's changed my whole life. So just be open is my point. I've even given some thought to becoming a cannabis educator because there's so much research for using CBD and not the active component THC of cannabis, and it helps autoimmune conditions and a whole host of other things. Complementary therapies, other kinds of therapies like acupuncture and massage, can also be useful for some people's pain. It's about exploring different options and finding what works best. I've done both those things. I even explored the energy healing modality Reiki, which I became certified in, and Hatha yoga and adaptive yoga, which I also became certified in and I have taught as well. They totally work for me, and I can hear you screaming right now, don't freaking tell me to try yoga, and I get that. I don't know how many people have told me that. So I'll never tell anyone else to try it if it's not for you. It does work for me. I've mostly switched to adaptive yoga because of my levels right now. And I love it because I can stretch whenever I'd like, even if my body's not at 100%. But you do what works for you. Now, I'd love to guide you through a short pain relief meditation. This is adapted from some of the principles of mindfulness in the book I was mentioning, and it focuses on the mind-body connection. Find a comfortable position, either sitting or lying down. I'll give you just a minute to get settled into your chair or where you're lying down. Gently close down your eyes if that feels comfortable for you. If you'd prefer to keep your eyes open, softly focus on something in the distance and just kind of let your eyes be. Let's begin by taking a few deep, slow breaths. Inhale deeply through your nose. Fill your lungs completely. And exhale slowly through your mouth. Notice the rise and fall of your chest or your abdomen. Now let's do something called a 3-3-3 breath. Breathe into the bottom of your belly for 3, the middle of your belly for 3, and then fill up to the very top of your lungs for 3 more. We'll hold at the top for 6, and then exhale. Are you ready? I'll walk you through it, don't worry. Let's go through the bottom of your lungs, 2, 3, the middle, 2, 3, the top, 2, 3, hold, 2, 3, 4, 5, 6, exhale. One more of those. Bottom of your lungs, 2, 3, middle, 2, 3, top, 2, 3, hold, 2, 3, 4, 5, 6, exhale. Very good. Resume your normal breathing, just very natural. Now let's bring your awareness to your body. Notice any sensations you have in your body without judgment. You might notice areas of tension, areas of discomfort, or perhaps a sense of warmth or coolness. We've done this before in a full body scan, but that's a little bit longer. For today, let's do a faster scan from your toes on up through your body. I like this because if you go faster, you don't have as much time to think about it and possibly judge or explain away anything. Just feel. Simply observe the sensations from the top of your body to the bottom, from your toes back up to your head. Now let's bring your attention to the area where you experience the most pain. Don't fight the sensation. Simply observe it. Notice its shape, its size, its intensity. Does it have a color? Is it moody blue or fiery red or orange? Imagine your breath flowing to this area. With each exhale, imagine a gentle, soothing light entering this area, bringing with it a sense of calm and relaxation. You can give it a color or a sound if you like, or just concentrate on the whoosh of wind coming in and out of your lungs. With each exhale, imagine any tension or discomfort gently flowing away. Inhale light, exhale tension or pain. Continue to breathe deeply. Visualize this soothing light surround the areas of pain. Sometimes I like to imagine the light as sparkles lifting the pain away. You might notice the intensity of the sensation shifting or changing as you breathe. Simply breathe and observe these changes without judgment. Now expand your awareness to your entire body. Do that quick scan again. You're taking care of yourself. You're wrapping your body in the warm light like a hug. Notice how your body feels as a whole. Allow yourself to rest in this state of gentle awareness. Just rest. Take a few more deep breaths. Take one more, the deepest breath you've taken today. And when you exhale, make an audible sound. When you're ready, gently open your eyes. How did that feel for you? Even short periods of focused attention and relaxation like that can make a difference in how we experience pain. I hope you liked my sparkles imagery. It's the rainbow bright My Little Pony part of my 80s, 90s childhood talking. I'm sorry. I like sparkles. What can I say? It's important to remember that managing chronic pain is a journey. It's not a destination. There's got to be good days and there's got to be bad days. But be patient with yourself and don't hesitate to seek support. The most important thing to remember is to use what works for you. You're the expert in your chronic pain. You're not alone. Also, I have to add, I'm not a doctor, and all of my advice is anecdotal. Do your own research and use your own doctors to find what works for you. I just have to throw that caveat in there. Remember, you're resilient. You're iconic. With the right tools and support, you can manage your chronic pain, and it can help you live your life the way you want to. Thank you so much for listening today. If you liked the episode, consider telling a friend and leave a review or a rating if you would. I'll see you next time.
Sometimes we have to start over. Sometimes we have to fight back. Sometimes it's all too much. Lost inside the black. Our stories are brilliant. We are resilient. Our stories are brilliant. We are resilient. Sometimes we need to lift the voices of those who've overcome and expose the ones that made the choices to not